Hi, this is going to be a short discussion on Mosuo health disparity, and my name is Margaret Tolman. Let's start with some background on the Mosuo culture. They are a matrilineal society in China, actually the only matrilineal society left in China. A matrilineal society just means that they follow their lineage through their mother's line, and that the women are also head of household and run the families. Many of the Mosuo live in the Yunnan province, which is in the southwest portion of China, and it is also one of the poorest and most remote provinces in all of China. The Mosuo also live near Lake Lugu, which is on the border of the Yunnan and the Sichuan province in China. It is a very remote and rural region. Some of the health disparities in the Mosuo culture and the surrounding areas are poor maternal health care. They have poor maternal health care for many reasons. Lack of access to hospitals due to the remote nature of where they live. Poverty, and one reason poverty plays a big role onto maternal health care is that if you don't have the money to get a car or other kinds of transportation, then you really wouldn't have any way to get to a hospital, even if there was one in an area that you wanted to go to. And also lack of education plays a role into maternal health care, because if you're not educated, then you don't know the importance of things like prenatal care, having a skilled birth attendant, and postnatal care. So as I said before, due to lack of access to healthcare, lack of education, and high poverty rate, women don't know that they should or don't know how to get prenatal care. And then poverty, as I said, decreases the resource to be able to get to health care or hospitals. Also, the majority of women in this area do not deliver at a hospital or have a skilled birth attendant. A lot of times they have someone in their family or in their village that has a lot of experience with delivering babies, and that is who they call upon if they need to, or they have what is known as a traditional midwife, which is someone who is just trusted to help with the delivery procedure but has no formal education. Due to this decreased maternal health care, lack of prenatal care, and lack of having a skilled birth attendant or delivering in hospitals, maternal mortality rate in rural Yunnan regions are very high. They are 258 persons per 100,000 people. This is 5 times as high as the national average in China. China previously had a very high maternal mortality rate, and to respond to one of the Millennium Development Goals, which was to decrease maternal mortality by 75%, they encouraged many people to start delivering in hospitals, getting prenatal care, and decreasing the amount of births per woman. Currently, 90% of China's population delivers in hospitals, and the maternal mortality rates have decreased 6% each year between the years of 1996 and 2006. However, many of these changes were seen in populated areas of China and weren't seen as drastically in less pronounced rural areas. This is because of all the reasons I previously stated: lack of access, lack of knowledge, and lack of resources available to them to even get to hospitals. This is why it is such a health disparity among the Mosuo people. Therefore, they have a less pronounced changes and increases in maternal health care. Therefore, in the future, it will be important for China to focus on their more rural regions to promote education and access to healthcare. Thank you for listening to my short presentation.